Hello, my name is Monica Ashton, and I'm excited to share my poster presentation with you today, entitled "Are Medical and Mental Health Professionals Aware of Protective Factors that Reduce the Risk of Perinatal Mood and Anxiety Disorders?" In way of introduction to the study, we know that perinatal mood and anxiety disorders are the #1 complication during pregnancy and postpartum period. So 1 in 5 birthing individuals, 1 in 3 birthing individuals of color are at risk of developing a perinatal mood or anxiety disorder. 1 in 10 partners or parents of birthing individuals are also at risk of developing a perinatal mood and anxiety disorder, which is that umbrella term for mental health diagnoses that occurred during that perinatal period. So the question is, how are these providers ethically supporting that risk reduction and service delivery for perinatal clients? Focusing on protective factors, those factors which reduce the risk, that preventative piece, we identified in the literature review that there were 4 protective factors that had more than one study conducted to identify it as a protective factor, which included social support, socioeconomic support, resilience, and wanted pregnancy. It was a mixed method design, part 1 being a quantitative analysis, a 10-item questionnaire emailed to providers. And part 2 was a qualitative interview of those providers that answered the questionnaire. There were 16 mental health participants that volunteered to be interviewed. These are some of the questions in the quantitative portion that identified what is it that providers know about protective factors and how are they utilizing that information in practice. 85 individuals were responding to the survey, and unfortunately not all questions were answered by all of those individuals. 84% of those respondents did identify as mental health professionals, 16% identified as medical professionals, of which 70% had at least 14 years in practice, and 48% had a practice that consisted of more than, or 50% or more of perinatal clients. So the results from the study, with an N of 77, we found that every participant that in the study, 100% of individuals were able to identify at least one protective factor, with 96% of individuals being able to identify social support as a protective factor. And the next one would be socioeconomic support, was the next protective factor that was well known among providers. There wasn't any provider that was able to identify all 4 protective factors correctly. And there also was not any provider that wasn't able to identify one of the protective factors, with the majority of providers identifying at least 2 protective factors. There was no statistically significant relationship between a provider's confidence in their knowledge or in their years in practice or their percentage of perinatal clients in practice that was significant as far as being able to identify those protective factors. But we did find that the majority of providers are talking to their clients about these protective factors and discussing it. 76% report to be discussing them at least half of the time with their clients. Most were gathering their information from professional conferences or other professionals in the field. And based off the interview findings, we found that there was not a lot of training or focus on protective factors. And most were getting their training from a singular organization. Although many wanted to know more about protective factors and perinatal mental health, almost none of them had any sort of training in perinatal health in their graduate programs, but it was all postgraduate seeking out additional knowledge. So the conclusion was that although most providers are aware of these protective factors and are talking to clients about them, they weren't able to identify all of them. So clients were not given all of the information based on lack of provider knowledge. So this leaves patient education incomplete. And ethically approaching and working with perinatal clients, it's important to do both prevention as well as risk reduction. And if providers are aware, they're able to give their clients better information. So that strengths-based approach and understanding is important. And we also could find new interventions with a preventative approach as well. So more research needs to be conducted about protective factors and presented at professional conferences and in circles. So these are some of the works cited, and I want to thank those that were provided the interviews as well as participated in the survey and supported the research.